Good evening, everyone. My name is Dana Lonis, and as Taylor said, I'm a nurse practitioner in upstate New York, and I'm here to very happy to be here to discuss with you diabetes, sort of the basics of diabetes. And with the population that we're discussing, the folks that are involved in the Special Olympics and your health forum, our goal is to just identify where and if you may be able to pick up on the earlier signs of this disease and impact folks earlier rather than later and hopefully um, help them with the disease of diabetes. Every 23 seconds, someone is newly diagnosed with diabetes. Just think in your mind, I highly doubt that there isn't one person that wouldn't raise their hand. I know for myself, I would be raising mine, and I'm not sure, Taylor, if you could speak to if you know, at least know someone who has diabetes. Most people do. Uh, so it just gives you something to think about. But you don't necessarily know people with other diseases, but a lot of times with diabetes, you do. 1 in 10 of Americans has been diagnosed with diabetes, which doesn't even mean that they're not living with diabetes and have been undiagnosed or have prediabetes. So 1 in every 10 Americans is currently diagnosed with diabetes. The slide here represents the numbers that we're seeing. There's 210,000 American youth living with diabetes. There's 18,000 newly diagnosed type 1 patients every year. And when we say youth, we're, you know, under the age of 10. And then more than 6,000 new cases of type 2 diabetes. We used to only see type 1, higher prevalence of type 2 in our young folks. It is considered to be a public health crisis. That's why I'm excited to be able to share with you, to be able to act with you, anyone around you that could be with pre or diabetes. We are the American Diabetes Association. Um, we are very proud of the fact that we are pursuing treatment, prevention, and cure for all types of diabetes. And we are extremely excited to be here with you guys tonight because we are fighting for the rights of all people affected by diabetes. It doesn't leave anybody alone, unfortunately. It affects all different cohorts of people. We are internationally recognized at the ADA. We're a trusted authority in diabetes care and education, and we use evidence-based standards of care to guide folks like myself, healthcare providers, and to inform those living with diabetes and those educating people living with diabetes. We have education specialists all around the United States and around the world that are using these same standards of care to try to combat the disease. We have a comprehensive approach that we use um, up to treat the disease, to try to prevent the disease, to try to improve the lives of people living with disease, and eventually, hopefully, find that cure so we can eradicate the disease. This is another slide here. It's just designed to show that we're using that evidence-based research continually to try to impact the providers and the folks living with diabetes long term. The organization ADA is renowned for the work that they do to prepare people that are treating the disease and living with the disease. So at this point, I'd like to just get into what prediabetes and diabetes is with your folks. Um, Prediabetes is when your blood sugar or your blood glucose is higher than normal, but it's not high enough that we would diagnose you with the disease. So basically, prediabetes is a warning sign for everyone. It's a serious condition. We take it very seriously. Um, but it it is something that if we're able to really start to work with you early when these numbers are in the pre-diabetes stage, we may be able to prevent a full-blown diagnosis of diabetes. 81% of Americans with diabetes don't know that they have it. So earlier on, when I was talking to you about the number of people that we have diagnosed with this disease, which seems astronomical at 96 million, look at how many people may not know that they have prediabetes that are going to continue to fall into these numbers. Um, so again, we're looking to impact people early on. Prediabetes can lead to type 2 diabetes and many of its serious complications. There is a 60-second test you guys can take here. When you have a chance, just click on that hyperlink and go ahead and see if you can lower your risk there. So, we'll talk briefly about what diabetes is. Diabetes is when your blood glucose level it rises higher than normal. There are three different main types of diabetes. There are some offshoots of diabetes that are a little bit too intricate to get into the details about, but what you'll typically hear about is type 1 diabetes, type 2 diabetes, or gestational diabetes. Oftentimes, people want to know if the food that they're eating is putting them at risk for getting diabetes. Um, food in the technical sense, say you're the type of person who eats a lot of sugary foods, that doesn't necessarily put you at a higher risk to get diabetes. What we know does put you at a higher risk to get diabetes is anytime you're overweight or your BMI is greater than 25. So that is really technically how food is related to diabetes. But what happens when you eat food is your body breaks that food down and sends it into your blood. Okay. And then insulin, which comes from your pancreas, helps move blood glucose from the blood into your cells. And this is essentially where you get your energy from. If you have diabetes, there's a problem with your insulin, but not everyone living with diabetes has the same problem. And when I say that, I mean if you're living with type 1 diabetes, you're not making that insulin or you're making not enough of it to have your blood glucose be turned into fuel. If you're living with type 2, you may be making enough insulin, but your body isn't using that insulin effectively. So that's what we mean when we say not everyone has the same problem. If your body is living with some of these symptoms right here, then that could mean that you need to seek out a healthcare professional to look into some of these symptoms because these are the symptoms of diabetes. If you're urinating often or going potty often, if you feel thirsty, very thirsty, e- especially when you wake up in the morning, if you start feeling hungry, even though it seems like you're eating, if you're extremely fatigued, if you ever have blurry vision, any cuts, bruisings, or any kind of wounds that are slowly healing, weight loss, even though like I said, you're eating more, but you can't seem to put on weight, and any kind of tingling, pain, or numbness in your hands or feet. Some of these are more closely associated to type 1 or type 2. The biggest two are really the ones at the bottom here. The weight loss really tends to be more associated with folks living with type 1 diabetes. And people with issues in their feet or their hands who are experiencing numbness or tingling, that tends to be more associated with type 2 diabetes. So, type 1, as we discussed, is different than type 2 in that it means your body is either not making enough insulin or not making any insulin at all. And that's because your immune system has mistakenly gone after the cells in your pancreas that make your insulin. Um, People living with type 1 diabetes have an immune problem, whereas folks living with type 2 do not have that. We're not really sure what causes type 1. It is not contagious and it's not caused by consuming sugar, as I talked about a little bit ago. Uh, the American Diabetes Association and other organizations across the world are trying to find the exact cause of type 1 and how it could be prevented in future. So, type 2 diabetes is where your body does not use insulin properly. That is actually, uh, we call that insulin resistance. So, you have the insulin there, but for some reason, your body isn't using that insulin the way it should and exchanging the glucose out of your blood and cells like it should. And what are the things that put you at risk for type 2 diabetes? Again, for type 1, we can't really give you risk factors because we don't know really what causes that. But for type 2, any history of high blood sugar or prediabetes, or if you were diagnosed with gestational diabetes in pregnancy, that puts you at risk for developing type 2 diabetes. Again, the thing you don't see on here is food, but what you do see is anyone living with obesity or a higher BMI. So food itself, you could be a very thin person but only eat candy bars. That consumption of sugar does not necessarily put you at greater risk for getting type 2 diabetes, but if you are living um, with being overweight, that does put you at risk. Physical inactivity, which oftentimes is interlinked to overweight or obesity. If you have a history of type 2 in your family, that also, we do tend to see that more strongly linked with type 2. Race and ethnicity, age, high blood pressure, and cholesterol problems. This slide is a little bit busy, but basically what it's designed to show you is that numbers that we're talking about, most people hemoglobin A1C i- is blood work that we draw every 3 months, and that shows us basically a percentage of glucose attached to your hemoglobin, which tells us your average blood sugar for a 3-month period. If that is less than 5.7, then you're normal. You don't have to worry about anything. If that number is 5.7 to 6.5, we're in that prediabetes phase that we talked about a little while ago, where this is telling us that your body is starting not to be able to take care of its blood sugar the way it normally would. And then if that A1C is greater than 6.5, we'll be diagnosing you with the disease. The fasting plasma glucose and the oral tolerance test, these are the same type of things. They're different numbers that put us in the normal range and in pre-diabetes range and in diabetes range, but they're all the same. We're just using those to help us understand what's going on with your blood. Gestational diabetes is diabetes that develops during pregnancy. If your blood sugar returns to normal after you give birth, again, that's great, but that does put a warning sign onto your provider and for you to continue to remember that you are at greater risk for developing type 2 diabetes later in life. If your blood sugar doesn't return to normal after your pregnancy, then you'll be diagnosed with type 2 diabetes then. But oftentimes we do see your blood sugar go back to normal. And then later in life, many women will develop type 2 diabetes. So, the diabetes treatments and what we can do to help once you've been diagnosed with diabetes, um, it can be treated and probably should be treated. And first off, when you come out of that pre-diabetes phase, with what we call lifestyle modifications. That means we would help you with your meal planning. We would encourage exercise regimens and anything we can do to help with weight loss and those modifiable risk factors that we talked about earlier, especially the weight. That really seems to be one place where we can impact people to help them deal with the disease early on. Of course, we have oral medications that we can use. We have insulin, which is something we'll use later on if other things don't work. And we have other injectable medications that you've probably heard of on TV, like Trulicity, Ozempic, things of that nature. Those are going to help you with diabetes, but they also may help you with weight loss. There's a lot of research going on with those GLP ones now that I think, they're here to stay and really helping folks. If we don't treat your diabetes, I'm sure you're going to be at risk for every one of the things you see here on the screen. And that is going to be heart disease and stroke, kidney damage, eye problems, and potentially even amputation of limbs. Diabetes is very serious and needs to be treated and needs to be kept under control. Okay, so what can you do if you have prediabetes or diabetes? First and foremost, um, don't ever be ashamed of yourself or not believe in your ability to care for yourself. There's so much we don't know about the disease, and it doesn't have any room for shame in it. It should be just like it's treated like any other disease. It's a disease of an organ in your body, just like heart disease, just like, cancer. It's not anything that should be seen as shameful. We would try to work with you to help you um, develop a healthy eating plan and lose weight if that's possible. One of the biggest things you can do, and you can see this when you're treating people with diabetes in the hospital, is try to incorporate any increased daily activity. Oftentimes, you get a lot of you guys are athletes, so it's good. You're already on that pathway, but a- any increase in that physical activity, we encourage patients to start out just by walking maybe out to their curb and then trying to go halfway around their block the next week, and then maybe three-quarters away around their block, and then that 1 block in a month, and then to build up from there. But again, any increase in that physical activity is really gonna help you deal with this disease. So SMART goals, are goals that are specific, measurable, attainable, realistic, and time specific. And the goal that I just gave you was an example of a SMART goal, where I would specifically say, okay, okay, you live here. I want to see you do. Just walk out to your curb the first week. Within the second week, we're going to do halfway around your block. Third week, three-quarters of the way. And then maybe in a month's time, we're going to have you going around the block once. And it may sound like not a lot, but again, it's realistic, it's time specific, it's something that folks can attain, especially if they have gotten into losing some feeling or having some kind of problem with their feet or their hands. We have to do things slowly and make them achievable. Here are some examples. If you have the opportunity to ever speak with a registered dietitian or nutritionist, they're phenomenal. But I think you've probably seen something similar to this in other areas of medicine where we want you to plan out those portions. Again, about half of your plate with non-starchy vegetables, a quarter of your plate with protein or your meat, a quarter of your plate with grains or starchy vegetables, milk and or fruit or yogurt, and water or a no-calorie beverage. So when we say no-calorie beverage, we're saying like a Diet Coke as opposed to a Coke. Um, and making sure that you understand the difference between the non-starchy vegetables and the starchy vegetables. Again, more of the starchy vegetables are going to be your carrots and things like that that are a little bit sweeter. And your non-starchy vegetables are going to be your more green leafies and your things that aren't as sweet tasting. Okay, so how does staying active help you? Well, your body is more sensitive to insulin. So when you're active, that insulin, it works better and your cells can take the glucose out of your blood, which is good. The biggest thing also that I'd like to tell you is that exercise, it naturally helps you to be happy, which is going to help you to stay, where your body mass index or your BMI or your weight should stay. It's just good for you all around. It has to be incorporated into your daily routine, just like brushing your teeth. Um, and again, what types of activities should you do? Any kind of um, activity that gets you moving, whether that be going out for a walk, going out for bike rides, going out for runs, swimming, going to the gym and doing strength training with weights, balance training, yoga, and flexibility are phenomenal. You There's all kinds of great free apps you can put on your phone to do just about any single one of these things. And I encourage my patients all the time to just find one thing that they like and stick with it. Okay. So there are three types of medications that we use for diabetes. The oral medications, those are probably the easiest because, again, that would just be in a pill form and you would just take that orally. Whereas insulin and other injectables, they're a shot and they would go, just underneath your skin in a shot form. Um, but if you did have to utilize any kind of injectable, we would do a lot of education with you to make sure that you understood how to do that. That and just because the medication is oral doesn't mean it doesn't come with some side effects. So even if you were just going on an oral medication, we would want you to be closely affiliated with a provider like myself to make sure that side effects were something you were keeping an eye out for. And definitely the American Diabetes Association, myself and Taylor, we are here to help you. We want to educate you about the signs of prediabetes, educate you about the things you can do, like staying active, like keeping your weight under control that will prevent you from getting diabetes. Then it all boils down to healthy living. We certainly have local ADA events that we can continue to collaborate with Taylor and the Special Olympics about. And we will definitely continue. Once again, there are some resources here. You can visit diabetes.org or call 1-800-DIABETES Monday through Friday from 9 to 5:30 to learn more about these resources.
Dana, thank you so much for taking the time to share that presentation with us. You said it a couple of times, and I will echo it. Special Olympics is very invested in the health of not only our athletes, but also anyone within the intellectual disability population. So we are here to be a resource, to be a place to help you make connections, whether it's to a provider, whether it's to information and resources like the American Diabetes Association. There is a reason that we are partnering up together, and it is to really make an impact on the health of our athletes.
Fantastic. It's fantastic.
Wonderful. Well, thank you so much, and thank you everyone for watching. We look forward to following up and giving you the opportunity to ask any questions you may have. And keep your eyes peeled for our upcoming January offering regarding mental health resources. Thank you so much.